Hi, in this video I'd like to break down the different types of classification of recurrent miscarriage and the importance of diagnosis before going for pregnancy. So recurrent miscarriage is what we specialize here at Antai Hospital. The prevention, diagnosis and treatment of recurrent miscarriage is what we are known for and what we specialized for the past 25 years. And according to its classifications, we can explain to our patients uh, the different types that there exist, and then also the nature of these types of recurrent miscarriage. So, depending on when they happen during the pregnancy, we can separate recurrent miscarriage into two categories, which is recurrent early miscarriage or recurrent late miscarriage. So, recurrent early miscarriage means you have repeatedly experienced two or more early miscarriages, which means these miscarriages happen within the first 12 weeks of pregnancy, your first trimester. And recurrent means you've experienced more than two repeated miscarriages over the same pregnancy week, roughly. This is what we define as recurrent early miscarriage. So for a recurrent late miscarriage, it's the same type of recurrent miscarriage, but it's happening later in the pregnancy, after week 12 all the way until week 24 to 28 in your second trimester and third trimester. These are known as recurrent late miscarriage. So between the two, recurrent early and recurrent late, recurrent early is far more common. 85% of all recurrent miscarriage happen within the first trimester, and only less than 15% occur within the second or third trimester. However, both these different types can be equally prevented, equally diagnosed, and equally treated here at Antai Hospital. So now I'd like to talk about the second classification, which is a recurrent primary miscarriage and a recurrent secondary miscarriage. So a primary miscarriage means that you have never experienced any healthy pregnancy at all. This is your first pregnancy and it ended in a miscarriage. So usually we will define these types of miscarriage as a primary miscarriage, which means you have no history of healthy pregnancy and your first pregnancy ended in a miscarriage. And if it happens repeatedly, you have repeated pregnancy loss and no success history, then this is known as recurrent primary miscarriage. And the second category is for those patients who are having a history of healthy pregnancy, which means these group of people usually have children already, but they start to begin experiencing miscarriages, pregnancy loss after a few tries. They have a history of successful pregnancies, but they start experiencing repeated miscarriages. This is the more common group that we deal with. Most patients are belonging in this group, which means they are recurrent secondary miscarriage. So all in all, we have four categories that we'd like to repeat again, which is recurrent early, recurrent late, recurrent primary, and recurrent secondary. So we can actually combine these four classifications together depending on what your nature is and when it occurs. And with these classifications, it better helps us here at the hospital, our doctors and nurses, to better assess your situation, give you the proper diagnosis and treatment. So here at the hospital, we understand that prevention of miscarriage starts with examination. We never recommend our patients to start straight away for their next pregnancy without going for thorough diagnosis for both partners. Only then, when we do thorough diagnosis, comprehensive examination, when we find out what is going on, and then only we will allow this patient to actually go for their next pregnancy. Because these treatments, these diagnoses, all it comes with a full refund guarantee, because we want to make sure that you do not waste your time and resources with us. We only want you to trust in us, in our expertise, in our skills, and that we want to make sure and we want to guarantee that your next pregnancy is a successful one. And it all begins with thorough diagnosis and examination. So we will be using a bunch of examinations and diagnostics. For example, we will be doing a blood tests for identifying specific antibodies such as anti-embryonic antibodies, which is responsible for the immunological factor. We also want to check for your endocrine hormones. You might need to do a transvaginal ultrasound to check for the cervix as well, a uterine dilation test, HSG, all sorts of imaging, 4D color Doppler ultrasound as well. All of these help us to properly assess what exactly is causing the miscarriage in the first place. Now, for patients who have within a day or two, we can easily identify what is actually causing your pregnancy losses and give you the appropriate treatment. Within a very short period, you will quickly going into treatment already, and patient quickly can start their pregnancy journey after receiving treatment with us. If you do still go experience any pregnancy loss or miscarriages after receiving treatment with us, then we will refund you full treatment costs as a sign of trust and guarantee in the outcome of treatment, and also the expertise and skill that we offer our patients. So get in touch with us via the website, follow our social media, and also stay tuned to each video that we upload daily. We want to assist you in your pregnancy journey, and we can ensure that your next pregnancy will be a successful one.